Hello and welcome to another episode of the Peninsula Biz Buzz. My name is Shelley Smith here as the Chamber Liaison with Peninsula SHRM and the owner of Premier Rapport. Bob, how are you doing today?
It's Friday here. Well, actually, when we put this on LinkedIn and other places, it's probably not Friday, but we're recording on Friday. And as you can see, I am at the Virginia Peninsula Chamber of Commerce headquarters today.
Yay, and we have our new Biz Buzz logo.
And our new Biz Buzz logo looks great, nice and sunny, right?
Yes.
And we're gonna have a sunny weekend. So things are looking up in my mind anyway, as we move toward recovery. And as we move toward recovery, I'm putting a button-down collar shirt on, I'm putting my blazer on, I'm coming back to the office. So commuting, stopping at gas stations, all those types of things, because we have to look forward with optimism as we open up our communities and our businesses and our nation. So today we are here with my friend, Colonel Clint Ross, from Joint Base Langley-Eustis. And Clint, it seems like just yesterday, you and I were sitting at a table having breakfast at the Hampton Roads Convention Center and celebrating childcare, basically downtown Hampton Child Development Center. And boy, the time has gone by fast. And that was 8 weeks ago now. So those were obviously more normal times and happier times. And your routine at the base was much different than it is today. So can you compare and contrast 8 weeks ago at Joint Base Langley-Eustis and today?
Yeah, hey, thanks, Bob. And Shelley, appreciate giving me the opportunity to spend some time with you today. And I think we're all becoming a little more familiar with this format of multiple screens on a laptop or otherwise a different type of computer or device. And so, this is indicative of a lot of the things we're seeing on the installation and off the installation is that people are creative. People are trying to find ways to make it happen and ensuring that we're taking some deliberate steps to stay connected and doing things like this. And so, there are multiple things that are challenging and maybe even a little frustrating. And selfishly, I'll admit, I enjoy my interaction with the local community leaders whenever we get a chance to get together. You get a sense for what's going on outside the installation at Langley and Eustis. And so just like many of us, we're missing that connection. There are differences in doing it this way, but I think this is outstanding that we found a creative way to continue to get together. Bob, to answer your question, before, 8 weeks ago, things were incredibly busy, like they are at a lot of places at Fort Eustis and Langley as well. And then it felt like part of the normal seized up. The part that did not seize up were the things that we do on a day-to-day basis to meet mission readiness, whether that's the F-22s you see flying over Langley Air Force Base, whether that's the training that's ongoing down at Fort Eustis. They still have an airfield that's operating. The Navy comes up and flies Blackhawks there, or HH-60s there, and then we still have rail cars coming in and out of Fort Eustis that they're loading and unloading, supporting operations ongoing. So there's a lot of the mission essential, and I just rattled off a few of those things to kind of give you an idea of what we consider mission essential, and none of that has stopped. The way we're doing it has changed. It may be with fewer people. It may be with individuals that are going to work shifts, and we've had folks that come in early, leave after their period of time that they're required to be there, and then someone comes in behind them and works like a shift, like another shift. And whereas normally they would be there together. We've had an increase across not only the Department of Defense, but specifically in the Air Force on the capability to log into your system from home on your home Wi-Fi. And so that your computer that is your government issued computer, you can log into it through Wi-Fi, and it looks exactly the same as if you were sitting at your desk at work. And so there's been a lot of folks have really been able to find a way to do many of the same things, whether it's on their phone or on their laptop, and then adjusting as needed for those meetings that we would normally have. The other piece that we've run into, there's some things that have changed that, for example, the Air Force and the Army have decided to postpone fitness testing. That doesn't mean you stop working out or working on your own personal fitness. It's just that with the closing of a lot of our facilities, for example, we closed our fitness centers, we closed the bowling center, our golf courses, the clubs, anywhere that we can reduce the number of potential interactions and then reduce subsequently the transmission of the virus. So mission, heavy focused on mission. We're still doing that. We still have units, Army units, Air Force units. Heck, we have the Coast Guard down at Fort Eustis as well that are fully prepared to do what they need to do if the Department of Defense or our nation calls us to deploy. That's still ongoing. The training associated with that is still ongoing. It's just some of the things that we do on a normal day-to-day basis, we've really, really reduced.
Okay, so talk about that's good. I mean, it's great to hear that the mission continues, and that's obviously the most important thing. Now let's pivot to talking about the airmen, the soldiers, and their families. So how are they holding up?
So it's different. It's different for everyone, and in that. So if you have children that are of school age, then you have new challenges that you have to deal with because you are now the default teacher. If we have a lot of families that are single parent, or they're single parent because one is assigned to another installation that's not close by. So a variety of scenarios there. So there are some challenges, but I got to tell you that, and I don't think you disagree, Bob, is that the military community, both the spouses, the children, as well as the service members, we are accustomed to being thrown into challenges that we were not trained for, that we were not briefed on, and no one told us about it when we signed up. And so a lot of us spent an entire career being thrown into unique environments and challenges that you were not prepared for and adjusting to it. And really what I'm getting at is there's a level of resiliency here that is very encouraging with our families. So we've had a variety of things where you see, maybe you've seen in media, other places where there's a kid that has their 13th birthday and they had big plans to have a party. And so some of the families, instead of having a party because it's prohibited right now, they drive by the house or they surprise them with signs in the yard. In my own neighborhood, there are some small children that were really looking forward to Easter egg hunts. And because we weren't able to do that, several of the families online built a map of homes where they took plastic eggs that were sanitized and placed them in the front yard, and families on their own were able to go house to house to house, and each kid could get one egg, and that way there was enough to go around. And so they found a way. They were creative and resilient, and they found a way to do the exact same thing. And so it was a lot of fun to look out my front window and see these small children walking around and excited to find the egg in the front yard. So there's tons of examples of that. The other thing that not surprising at all, and it goes on at both Fort Eustis and Langley as well, is that we've got a ferocious team of spouses that jumped up and started sewing masks. And the neat thing was that it wasn't just a mask you could wear in uniform, is that they wanted to make sure that some of the young soldiers and some of the young airmen had a mask that maybe was a little bit cooler or maybe a little bit more fun that they could wear to the PX, BX, go to the commissary or swing by the dining facility to pick up some food, so that they didn't feel like they had to wear the same grubby mask that they were in the uniform, or they didn't have a chance to wash it. And so they wanted to give them some options. And, they wanted to do their part. They wanted to contribute. And that's the thing that I've come to love about our military community, is that folks are always willing to step up and see where they can do their part to help out.
Yes, that was my experience too. Go ahead, Shelley.
I was just going to say, I love hearing all these stories, and one of my favorite parts of the Peninsula Biz Buzz is hearing what the community is doing in literally every single sector. And so I just I applaud all of the efforts in the entire community, and it gives you a lift to know about the resiliency, and it also inspires other people to do other things, and maybe if they're inside of their own funk, that it kind of pulls them out of it. So I applaud and appreciate you sharing all those different nuances and stories. I didn't mean to cut you off, Bob. I just,
No, that's okay.
I like all the I like all the happy stuff.
Well, we need that, right? We definitely need the happy stuff. So, all right. So you talked about several things, but let's and you talked about mission. But has the mission changed at all? So are there ways that the airmen and soldiers of Joint Base Langley-Eustis are supporting the COVID-19 response effort?
Sure, there are. Yeah, absolutely, there are, and it's out there. It's out there in the press, and it's something that there's a Joint Task Force for Civil Support that's headquartered at Fort Eustis, and this is right in their wheelhouse. This is exactly what that organization is put together to do. It's to respond to a crisis. Now, there's a variety of scenarios that they train for and build for, but I don't know that this one was one that was in their playbook. but it's a crisis. And where does this nation need support for? Primarily command and control. Because when you have a crisis, you have chaos. And if you don't have good command and control and communication, it's never going to be perfect, but you need to look to someone to be in charge and run that. And who better than an organization that trains to that every single day? So they took off and they went to support the effort. Unfortunately, the amount of cases in New York, right, drove that was going to be the hot spot that they were going to operate out of. So they set up at a couple different locations. I know they spent some time at another joint base, McGuire, Dix, Lakehurst, and they are in direct support of a very significant effort in New York. The other piece is that when the USS Comfort took off and went to New York as well, we received an opportunity to take some assets from Langley Air Force Base and offer up as assistance. And so they got far enough into training and orientation that we take some of our medical providers and help backfill the hospital down at Portsmouth. Because as you know, Bob, while it's a Navy hospital, they support Army, Navy, Air Force, Marine Corps, Coast Guard, just like the Langley Air Force Base Hospital, just like the Fort Eustis Hospital. So we take care of each other, and that was one of the ways that we were able to do it. We've been very fortunate across all the hospitals, but specifically in the military hospitals, that we haven't seen a huge rush or demand for additional services. So we may not have to send additional personnel down there, but it's driven by need. And in my book, that's a good news story. And that good news story, I believe, is a direct result of not only what is going on the installations to restrict movement, but what's going on outside the gates as well, because this is definitely a team effort. So it doesn't matter how much we do on an installation, it has to be a team effort outside the base as well. And that's very, very clear based on the numbers and seeing what's going on.
Okay, so speaking of healthcare and clinics and stuff like that, so you got McDonald Army Health Clinic at Fort Eustis. You have is it a hospital or is it what's the designation on Langley?
It's a hospital. Yeah, it's
okay.
It's one of the largest hospitals in ACC.
No, and yeah, I used to go there. Now I go to McDonald Army Health Clinic, but so they had canceled all elective surgeries, right? Elective surgeries had been put off. I think they're starting up again today at some of the hospitals in Virginia. Will that impact what happens on your facilities?
So some of the patients that have referrals downtown, what I haven't seen is, but I understand there's going to be a prioritization list. It's not just any elective surgery that anyone wants to have.
Right.
And of course, and this is probably a good time to mention, what comes along with that is not going to be what the normal elective surgery looked like before the pandemic. And so there's probably going to be increased hygiene measures and protective equipment that's worn by the healthcare providers, and then baby steps. All right, we're going to do a little bit at a time, and it's an opportunity to look at how are we going to coexist with this, because we're not going to turn a switch and it's gone. It's the effort is how do we gradually work back towards normal and the new normal, whatever that is. I know it's starting to sound like a little bit like a cliche, but I think it's a good reference point. And it's not going to be gone. So how do we operate in that environment? And so, right. Increasing. So right now we have about 70% of the appointments at the hospital are virtual appointments. Now, just because you have a virtual appointment doesn't mean that it's finished there. The virtual appointment frequently will turn into an in-person appointment. Right. And so then but step one is the virtual. And then surgeries, elective surgeries have been extremely restricted and limited. And so we're currently working through the leadership chain there to take a look at where we might be able to expand that, and to include pharmacy operations as well. On the medical side, there's a satellite pharmacy that we've offered. It's in the thousands, and sometimes we issue over 2,000 to 3,000 prescriptions a week. And that's both to our active duty dependents and retiree population as well. And we're issuing them up to 90 days, depending on what the medication is, so that the goal is we give that medication out so you don't have to continue to come back once a month, which means 3 more visits to an installation that already has restricted access. And we're trying to protect not only the installation and those that are restricted to the installation, but the healthcare providers that are working at the pharmacy during that interaction. So some unique ways of doing virtual appointments. Unique ways of distributing the medication. Fort Eustis is doing a curbside option that seems to be working pretty well. And so again, that kind of goes back to some of those creative solutions. The satellite pharmacy is operating out of the old bank, and they set up a drive-through process where, since we've taken reduced the number of dental appointments, we took those dental techs and poof, turned them into pharmacy techs. And so they're out there hustling and handing out medication because the demand has skyrocketed. And there's a desire to get those prescriptions filled as soon as possible. And so we've seen the numbers come way down now. That I think it helped that we had the 90-day prescriptions, and it's really reduced the number of foot traffic and vehicles coming on the base, which is the goal. That's the ultimate goal, is to reduce that foot traffic and presence on the base, where unless it's absolutely mission essential.
So I can attest to the efficiency and effectiveness of the drive-through refill pharmacy at Fort Eustis. I was up there the other day, and very effective, and they're doing a very good job. So and keeping it safe and doing social distancing and everything else. So impressive, as is everything that the military does, in my mind. Over to you, Shelley.
Well, I think it's time for us to put a wrap on today's episode. I am always curious, even as it's related to our military, do you see any of these new things that you're doing? Do you foresee any of them being carried forward into our new normal? Or do you think, no, from a military standpoint, we're absolutely going to go back to everything status quo?
Oh no! We're actually as part of this, and it's not unique to the Air Force. I think I'm fairly familiar that it's maybe different versions of it across the Department of Defense, but we're capturing this. We're logging the events as they go on, and then we're also capturing some new best practices.
Beautiful.
We've been forced to do something different, whereas in the past we maybe didn't even need to consider it because we had the manpower and the ability to gather in a location. And I think we're going to find some efficiencies that we just had never considered before, and a better way to do business. And so we will definitely carry those forward.
I love that. You know, that's one of my things in my day job of my company, is making sure that people are doing exactly that, logging it, tracking it, pulling it forward. This is the opportunity to innovate and get our design thinking hats on, for sure, and Scrum hats. So thank you for your time today. Is there anything that we didn't ask you that you wanted to tell us about?
Nothing that you didn't ask me, but I did want to take an opportunity to thank you again for letting me be a part of this, but also to highlight we have a large retiree population in this entire area, made up of all services, and they've been fantastic. We had a lot of them reaching out, like, what can we do to help out? I know we've had local businesses as well trying to figure out how can I get to the airmen and soldiers. We want to donate things. We want to provide assistance. What can we do to do our part? And it's the thing that makes me excited about working with our local communities, the willingness to embrace the challenge, and everyone wants to do their part in defeating this invisible enemy. And so I'll speak on behalf of all of Fort Eustis and all of Langley Air Force Base, is that we're grateful and appreciative for the relationships that we have and will continue to have with the local community. And it's just outstanding, and it makes a hard situation a little bit easier.
Nice. Well, thank you again. That's it for me today, Bob. Everybody, please comment, share, like, tell us who you want to have on, tell us what questions you have. Bob, you do the great final close. What you got for us today?
Hey, Clint, thanks a lot for being with us today. And you know, we're going to have another Military Affairs Council meeting here in May, and we're going to do it in our dystopian way of a video conference. But soon, hopefully June or July, I'll be able to greet you at the door of the Virginia Peninsula Chamber of Commerce with a coffee, and we can sit down together and do our MAC in person like we have always done in the past. So,
Bob, I'm looking forward to it.
Love the relationship with you guys. Let us know if there's anything we can do to help, and through this, we will get through this together. All right?
Thanks, Bob.
Thanks.
Thanks.